888-659-3727. Let's take a call. Hey, you're on the air. Who's this and where are you calling from?
Hey, Spencer. Hey, Joe. It's Dave from Liverpool.
Dave from where?
Liverpool.
Dave from Liverpool. Welcome, man. How are you?
Hello.
Holy smokes, man.
How I am? I'm
good. How are you?
I'm brilliant. It was just a quick call with regards. I'm looking on having my fourth surgery early next year-ish around that time. And as you know, I'm currently taking finasteride and minoxidil. And I just wonder what your opinion would be with regards to minoxidil, when I should come off it before the surgery, and how long before, and should you taper off it, and then when you can potentially go back on it after the surgery.
That depends on your physician. Each physician or each clinic will give you a different protocol to follow before your surgery if you're taking minoxidil. I know clinics that encourage you to continue using minoxidil all the way, up to the day of surgery, and then start back the day after or a few days after. Some clinics will say stop taking it 6 weeks before, 1 month. Personally, I'm not a fan of it anyway. And people need to understand what it does to the scalp. It turns the scalp into like this greasy, almost like gristle on steak type of texture that's very slippery. And so when you're placing grafts in the scalp, it can cause the pressure of being in this incision, because it's slippery. The graft can pop right out. I've seen this happen. It's really a bizarre thing to see. But I don't know if you can see the screen, but like the graft.
I can't see.
Okay, so people watching, if this is the plane of the scalp, the graft will literally just pop up like this and stand on end on top of the scalp. And I've seen that happen with like a dozen grafts at once. It's really bizarre. And the patient was on minoxidil. So other clinics, I don't know how they deal with it. Sometimes they'll do a lot of adrenaline to restrict blood flow. Doesn't always work, but I think you should be off of it for, I'd say a medium would be 3 weeks, because the other issue is because you've been on it for so long, you don't want to risk a shed from being off of it for too long. So that's the balance, and that's another reason why I don't like it, because a lot of clinics will have you come off of it before surgery, but then where's that threshold of where too early will cause the shedding to occur? I don't know. I mean, I think 3 weeks might be it.
Yeah, I mean, it's not. Do you know? I'll be honest. I mean, after my previous transplant, I've always kept my head shaved for like a good 6 months, until quite a lot of the hairs come through before I've grew my hair back.
Yeah.
So it's not a concern really, isn't it? What it looked like, regards like with a shed or the thickness. It was just mainly beforehand when you recommend coming off. But
well, when I talk about a shed, I'm not talking about the temporary kind. I'm talking about like the hairs that the minoxidil was hanging on to are gone, because the minoxidil is no longer hanging on to them, right?
Okay,
so those don't come back. They're gone.
Right. Okay.
Yeah.
So it's a bit of a difficult one, isn't it? To weigh up what's best to do, isn't it?
Yeah.
And also, Joe, I was wondering, with you having so many transplants, with my last transplant, I had FUE, and obviously they took grafts, because I've had 2 FUTs before that from above the scar on the back of my head, and also they took some beard grafts. I just wondered, on the back of the head, where can he take hair? Obviously, he can take from right to the back, but can he take it from more at the sides as well, or is it mainly just from the back of the scalp?
Oh yeah, no, you can take them from all the way up on the sides to right behind the temple, or the temple points, to within reason. You can go higher up. I'll put it like this, like with a strip surgery, like my strip scars go about as far forward as you can imagine before actually getting into my temple. It's maybe a centimeter behind my temple peak on either side. With FUE, you can go pretty much that same distance, but you have to reduce the density as of extractions as you're moving toward the front, because you don't want to have this sudden drop off or demarcation of low density to high density because of where the extraction pattern ended. So it has to be a gradualized reduction of density towards the front, but then you also have the benefit of going lower down towards the ears to a certain point, and you can go higher up onto the towards the parietal humps, not too far.
Yeah.
But it's very dependent on the patient and their physiology, because some patients you can look at and you can see that they've got really strong donor hair higher up, and you can safely take that hair, or so we think. But all indicators show that. But yeah, I mean, you can easily go very far into the sides as opposed to just the back. And actually, that's the preferred way. Even if you're having a small procedure, virgin scalp, 1,000 grafts, which is not a big procedure, I'm a big proponent for taking all those grafts from the entire donor area to really create as little impact to the density as possible.
Yeah. Cool. That's good. I mean, as I say, I had beard grafts with the last one, and I've got quite a good growth and healthy beard, and especially a lot of hair under my chin to the Adam's apple type point. So I was potentially thinking about getting quite a lot of grafts moved from there, and grafts obviously from the side of my head as well, to have me fourth and final transplant, and then hopefully that'll be me done.
Do we know where you're going? Did you disclose that before?
To be honest, I'm not sure. I'm going to do quite a bit of the last operation, or should I say, the hair transplant I had was I went to Chandigarh in India to the Darling Buds, Dr. Bhatti, and I got really good results from him. So I'm potentially maybe going to go back there. But
I mean, if you've got good results from Dr. Bhatti, and
it's like why not go back?
It's like why not go back, especially the price is right too.
Yeah, the price. That's I mean, the price is great. I mean, that's not the most important thing, but obviously, if you're on a budget, you know what I mean. It is important.
I agree. It is not the most important thing. The only reason I brought it up is because you've already had experience with Dr. Bhatti.
Yeah.
So
I think it's more important for patients. When you find a doctor that you're happy with when it comes to hair restoration, in my opinion, it doesn't make any sense to hop around to try and find other doctors, because if you find that doctor that has the combination of, a good pre-op protocol, making sure that you feel comfortable and welcome in their clinic, obviously, the surgical skill, the final result, how they treated you afterwards. If you find that perfect storm, don't go looking for another one. Unless there's some sort of, unless your passport won't let you back into India for whatever reason, I see no reason not to go back to them.
Yeah, to be honest, the two surgeries before and then going on to this third one, the results are just light and day. It's just night and day to say. It was unbelievable.
Who did you go to before?
Who was the first one?
The first one was it was in Malaga in Spain. It was with a company called Vinci. That's obviously in different places all over the world.
I know Vinci.
And then the second one was with the same surgeon, but it was privately through him, not through that company. So it was with his own company. And he was working for Vinci.
So let me ask you this. So you said it was like night and day. So your first surgery, and again, this is for, obviously, this is something you've been through personally, but this is really for those who are listening and who just tuning in to kind of, share this experience, because a lot of people go through this. Were you unhappy with the first surgery, or did you think that the first surgery just maybe wasn't enough, and you were told that you needed another surgery to get to where you needed to be?
I've got mixed feelings, really. I'd say, with hindsight, I was happy because obviously, your previous call, you were saying about framing the face and stuff. So framing my face gave me a hairline.
Right.
My expectations were probably for it to be better, but I think my expectations are unrealistic. Based on the consultation saying you'll potentially need 2 surgeries, but the first surgery will be hairline to mid scalp will be full, and then potentially second surgery to fill the crown. As it turns out, after my third surgery, I'm where I've come from to where I am now is just unbelievable. I have nothing, you know what I mean? And now it's to the point now where, you know, it's me who notices the thin areas where I think other people wouldn't even really notice them, to be honest. I mean, I sent Joe a couple of pictures after we spoke last time, a couple of weeks ago. So, I mean, she sent me before picture and a few after pictures.
So, so overall, okay, so that I just kind of want to get an idea of what your experiences were prior to seeing Dr. Bhatti. But overall, would you say that the entire experience of having 3 hair transplants was a good one?
I'd say only after the first 2, it was just a nightmare, as in I was always questioning, why have I done this? I wish I wouldn't have done this. Using concealer to the point of, you know, myself thinking, you know, the paranoia of can you see it, and all that goes with that. It was after the first 2, I regretted it and wished I would never have got a hair transplant. And the third one's put me in a position where it's eventually been a good decision through a lot of years. And I'm now in a situation where I think if I have the remaining hair moved, which from the donor data I've got, I think I'll be as happy as I ever could be, and my expectation will be met that I had from day one.
Well, that sounds good. It sounds like you finally you're getting to a place, and you got to a place after your 3rd surgery where you're comfortable in your own skin. You're no longer questioning your decisions, and that's big. That's a big thing.
I got a question though. So you went to the first doctor at Vinci, but then that doctor left, and you followed him to his private practice. Why did you follow him to the practice? Did he contact you, say, I'm now working with myself or for myself, or did he leave and then you went looking for him?
Well, he didn't leave. I believe he still works, or at the time when I had the 2nd surgery, I believe he still worked for Vinci, but he had his own clinic in Marbella. And from the first surgery, we kept in touch via social media. So when I was due a 2nd transplant, when I was looking to fill in the crown area, I contacted him direct, and he said, you know, we were chatting. I sent him a few pictures from the first surgery before I decided the 2nd surgery, and I just mentioned to me, I'm looking on a 2nd surgery, we're chatting, and he just said, yeah, but you can come straight to me, come to my clinic in Marbella as opposed to go through Vinci.
Okay.
And that's how that happened. So it was the same. He must have the same team following around. It was the same technicians that were working for both. So yeah, with hindsight, big mistakes. Should have done more research, which I've got to take on the chin. And I think the only problem is that where I'm going now, I was kind of restricted to the point that I needed to have FUT, and I probably the 2 FUTs I had. If I'd have had really good surgeries, FUT, it would have obviously been better, but if I'd have had FUE straight away, I would never have got the coverage I need. So Dr. Bhatti only does FUE, you know, so he doesn't do FUT. So if anyone looking on going into his clinic, I think it's better for smaller operations or people who've got great density in the donor area.
Okay.
All right. Well, listen, we're going to have to call it a day, but I appreciate the call, and I think that obviously your question, I should put the camera on me. Your question about minoxidil is an important one, and I think for those who are tuning in who are either considering surgical hair restoration or hair transplant surgery, who have undergone hair transplant surgery and may not have been completely happy with their first result, you're an example of, okay, you may not have been completely thrilled and you were questioning your decision, but after your 3rd surgery, you're in a position where you're satisfied, you are happy, and you think that in the end you made a good decision to undergo surgery. There's a lot of guys out there that are still questioning their decision, so it's good to hear a story like yours, and for them to be able to hear it as well.
And I would encourage you. I'm not going to tell you what to do, but I think that it's in your best interest to not be so anxious to find other alternatives once you've found someone like Dr. Bhatti that really, obviously, in your own words, made a night and day difference for you as far as your outcome. It's I don't want to say it's rare to find someone like that, but you're much more likely to find an experience that's not quite as good when you start going out there and trying to find someone else after you've had a great experience.
Yeah, I mean, to be honest, Joe, I mean, that's I think the main thing for me with regards going back to India is the distance and it doesn't bother me the distance. That's wrong. Now it's the once you've had the transplant, coming home with a hair transplant on a connecting flight and waiting in airports and
I'll tell you how to avoid any issue, and that's simply stay in Chandigarh for a week or even 4 days. And after 4 days, you're pretty solid.
Yeah, I stayed for 5 days last time.
Okay, yeah, you're fine.
So that's okay. I mean, that was my main concern, was coming home with, I don't want to, I haven't washed it or getting knocked or whatever. It's just that was my main worry. With India's a very busy place as well, so it's quite the hustle and bustle of Delhi airport was quite something.
Yeah, no, I get that. I understand that, and I think that the best thing for you is if you want to go back, to avoid any sort of potential for someone banging your head and knocking grafts out, is stay in Chandigarh for a week and just enjoy the sights, and then hop on a plane and go home, and everything will be fine. You'd have to get hit in the head pretty hard for the grafts to come out after a week. Yeah.
I just wanted to say as well, I mean, that clinic in India, I mean, I know this is probably horrendous. I'm sure there is terrible clinics. We hear stories in Turkey and India and different places, but that clinic was just brilliant.
Well, I hear he's got a new facility now too. He's got a new hospital that he built called Five Rivers. Yeah, it's supposed to be nice.
Okay.
You know what I like about Dr. Bhatti is, first of all, he's one of the few doctors out there. It doesn't matter what part of the world you're from. Everyone has fears of being honest and telling the truth about what's happening in the industry. Dr. Bhatti is not one of those guys. He will speak his mind and let people know exactly what's happening. He does have an incredibly high-tech, beautiful facility, and his new facility is more beautiful than the one that you were at. And I guess what I think is difficult for a lot of these guys, even the better Turkish doctors, is they are forced to compete with all of these chop shops that are just, I mean, you wouldn't even want to walk into these places. I mean, I've seen guys who are wearing sandals during surgery. I'm not joking. Exposed feet.
Wow.
So, I mean, so I don't want to, when we talk about Turkey and India, and I'm glad that you brought this up, I don't want to use this broad brush and saying that all these clinics are shit, because they're not. That's why we have a couple of doctors on the IAHRS and a couple of guys from India on the IAHRS as well, because these are they're the anomalies in their parts of the world. And you were lucky enough to find Dr. Bhatti. So I think Joe's right. I mean, the way that I see things is, if it's just out of convenience and you're concerned about travel, that shouldn't even be put into the equation. If you're happy with the surgery, and apparently you are, and you're happy with the treatment and the facility, that should be your main concern. Everything else can be worked around.
Yeah, definitely, I agree.
All right,
and
man.
Just finally before I go, Joe, do you know the you're saying about Dr. Bhatti's new clinic? Is that in a similar location in Chandigarh, or does he?
I have no idea. I know it's in Chandigarh, but I don't know.
Right. Okay.
I don't know where. It may or may not be close to. I saw pictures, and I think it's. I don't know where his old place was, but I think it's on top of a hill someplace. That's just based on pictures I remember seeing.
Yeah. His old place
with a view.
Quite a built-up area. Yeah, cool. Well, it'd be better. I mean, it was quite shocking, really, when you're seeing. I mean, it was the biggest eye opener in my life going to India. It was an amazing place to be. But where it was last time, it was by a little shopping square with all shops, and it was on the top of quite high up. But it was you went into the clinic, and it was just the cleanest place with the most friendly people. It was just amazing experience.
Well, that's great, and it's important for others to hear that as well. So listen, man, I wish you the best of luck. Let us know what you decide to do and when you decide to do it. And we're here. We're going to be here at least twice a week live. So anytime you have a question, feel free to call.
Brilliant. You have a good rest of the show, and both you guys take care.
All right, man. You too.
All right,
take
thanks
care.
for calling.
Bye-bye.
All right. Thank you. Take care. Bye-bye.